Imagine your local town pharmacy. On a busy morning, it's the perfect example of a market. At its simplest, a market is just any place where two groups, the people who sell things and the people who want to buy them, can communicate and make a trade. In this healthcare market, the sellers are the professionals who provide care. It's the pharmacist stocking the shelves with medicine, or the nurse preparing a flu shot. The buyers are everyone else in town. They are the people looking for a way to feel better, or wanting to stay healthy with a vaccination. Most of us want to be healthy. If you have a scratchy throat, you might strongly wish for some lozenges. In economics, we call that a need. It's a personal feeling, but on its own, it doesn't actually affect the market because money isn't part of the conversation yet. To truly influence the market, that need has to become what we call effective. This happens when you have both the desire for the medicine and the money in your pocket to actually pay for it. In the end, wanting a treatment only matters to the economy when a buyer is standing at the counter, ready and able to spend their money to get it. Let's look at a single product, like a box of cold medicine. There is a very specific relationship between the price on the sticker and how many boxes the townspeople will actually take home. We track this on a grid: price on the vertical axis, quantity on the horizontal. At a high price of $10, few buy it, marking high price, low quantity. As price lowers, quantity goes up. Connecting these points creates the demand curve. This shows us an inverse relationship. Generally, as the price goes up, people buy fewer units. As the price goes down, the amount they want to buy increases. This diagram shows that movement in detail. If price falls from $10 to $7, moving from 55 to 75 boxes, demand grows, an extension. If price rises from 10 to 12, buyers drop to 40. Demand shrinks, which is a contraction. The most important thing to notice is that the black line representing the buyer's behavior stayed exactly where it was. Changing the price simply makes people slide up or down the track they were already on. It changes how much they buy today, but hasn't changed their underlying desire for the product. But then, the real world steps in. Winter clouds roll over the town, the temperature plummets, and a heavy flu season begins. Back at the pharmacy, the cold medicine is still sitting at its high $12 price, but despite the high cost, people are suddenly buying way more of it than they did before. This breaks our previous rule. If the price hasn't changed, but people are suddenly buying more, we have to look for factors outside of the price tag. We call these the demand shifters. These are the real-world events that change how people behave regardless of what the store is charging. This chart shows what these shifters look like. It could be seasonal changes like a cold winter, a new advertising campaign, or even an increase in the townspeople's income that allows them to afford more. When these outside forces make people want a product more intensely, they will buy a higher quantity of it, even if the price stays exactly the same. On our graph, this looks like the entire line is jumping. Even with the price staying at $12, the whole demand line shifts to the right, showing that quantity jumped from 80 all the way to 115. The opposite happens if the flu season ends and summer begins. People buy less medicine at the same price, shifting the curve inward to the left because their circumstances have changed. This is the core of the market. Changing the price tag causes a movement along the curve, but changing the buyer's lives causes a shift of the entire curve. The price of a product tells us the cost of a trade, but to understand what is truly moving the market, we have to look at the factors shaping the lives of the people who pay it.